Sinuses are normal structures that are found in the human body. Everybody, all of us, have sinuses. And basically, sinuses are spaces that are found on the face, around the nose, and they are connected to the nose, such that if you have disease in the nose, it will by extent affect the sinuses and vice versa. We talk about sinusitis broadly as being allergic or non-allergic. Allergic, we shall talk about it later. It is caused by certain things in the environment that are harmful to some people and not harmful to the majority of other people. Now, when we talk about infective sinusitis, we are talking about that form of sinusitis that is caused by infectious organisms. We are talking about viruses, we are talking about bacteria, and we are talking about fungus. Now, for the infectious sinusitis, the commonest will be viral, that is the sinusitis that is caused by viruses. And this one, the best way to look at it is like a common cold. A common cold that comes, then within 3 to 4 days, it has not disappeared. So we would call that viral sinusitis. Then we have also other forms caused by bacteria, and there are very many bacteria that give sinusitis. Basically, you do not need to do any investigations to make the diagnosis of sinusitis. The diagnosis is what we call a clinical diagnosis, and that is, it is based by the history that the patient will give us, and then after that, the examination findings. I will talk about the history, or I'm going to talk about the symptoms that may point to sinusitis. Now, the first symptom is blockage of the nose. And when we talk about the blockage of the nose, sometimes we might refer to it as congestion of the nose. So either blockage or congestion of the nose as one symptom. The second symptom that the patient may report will be a running nose. Now, the running nose, you can have the mucus coming from the front of the nose, or sometimes you might have the mucus going to the back of the throat, and we call that postnasal drip. The color of the mucus does not matter. It can be watery, can be yellowish, can be greenish, can be blood stained, but as long as it's mucus or as long as it's a running nose, then we consider that. So the two cardinal symptoms of sinusitis is a blocked nose with or without a running nose. One of those symptoms must be there, and would call those ones the major symptoms. Now, we have the minor symptoms of sinusitis, and these include things like facial headaches. Sometimes you might not call it a headache, but you might say you have congestion around the face, or a feeling of pressure, or sometimes the patient might say, when I bend down, I feel like my eyes want to pop out. So pressure symptoms around the face. The other symptom will be things like loss of the sense of smell. Somebody might say, before I got this condition, I could smell everything, but nowadays I'm not able to smell things. And I hear people complaining that they can smell something and I can't smell it, or I can't smell food when it's being cooked. Then the other symptoms also things like fevers, if it is caused by an infection. But if it's allergic, then there will be no fevers. Now, other symptoms, especially for sinusitis that is caused by allergies, include things like sneezing, whereby the patient will tell you, every time I wake up or every time I go to this place, I sneeze very much, my nose gets irritated, starts running, and I sneeze very much. So I would say those are the common symptoms of sinusitis. Now, after considering the symptoms, and the symptoms is what the patient tells us, then as a doctor, we go ahead and examine the patient to see whether there are any signs in this patient that could be suggestive of sinusitis. Now, these signs include one, when we look at the nose will appear congested. the lining of the nose appears boggy or inflamed, and during the examination we are also able to see the discharge or the mucus that is coming from the nose, and we can qualify the mucus. Is it watery? Is it yellowish? Is it greenish? All those kind of qualities we are able to determine. Now, that examination is carried out in the clinic by what we call anterior endoscopy, whereby we just look at the nose of the patient without using any special instrument. Now, going further, if you want to examine deeper in the nose, or sometimes what we call the posterior part or the back part of the nose, then we use some specialized instruments which we call endoscopes. And with the endoscopes, these are just small telescopes, small cameras that we put inside the patient's nose, and then we are able to see everything in the nose. We are able to see all parts of the nose. We are also able to see the sinuses and where they drain, and with that one we are also able to make a diagnosis with a lot of certainty, and we are sure that whatever we are calling sinusitis will be sinusitis. Now, sometimes we require other specialized studies to be sure or to determine the extent of the sinusitis. And what comes to my mind at this time is doing a CT scan of the sinuses. Now, what is important is that this CT scan is not normally to diagnose the sinusitis, but it is to determine the extent of the disease. Because again, we said we have very many sinuses. We need to know, does a sinusitis affect all the sinuses, or does it affect others and others are not affected? And that's how the CT scan comes into play. Again, the CT scan helps us when we are planning to operate the patient, so that we can be able to know how we are going to approach the disease when we go to theater. But again, I'm going to repeat that the diagnosis is basically made from the symptoms and the signs of the patient. Treatment of sinusitis is basically, or is principally, a medical treatment. Medical, and then sometimes we have surgical treatment. And I'll first talk about the medical treatment. Now, the medical treatment, it varies sometimes depending on what we suspect to be the cause of the disease. So obviously, if the disease is caused by an infection and the patient has got fevers, the patient has got headaches, then the first thing we do is to give them some medicines that is going to control the fevers and a medicine that is going to control the headaches, because we do not want the patient to be suffering as we are eliminating the cause of the disease. Now, having given them that, then we also use a lot of nasal medications, and these are medications that are given into the nose. We normally use what we call nasal sprays. These are medicines that come in form of a spray, and the patient is able to spray the medications inside the nose. Why we use the sprays into the nose is because once in the nose, the sprays they reduce the inflammation, they reduce the swelling of the nose, they reduce the irritation, they reduce the production of mucus, and by doing so, then even the headaches and the congestion that the patient could have disappears. Now, apart from that, then sometimes we use antibiotics, and the use of antibiotics again is if from my assessment or if from the doctor's assessment the sinusitis is being caused by a bacteria. If it is viral, if it is fungal, if it is caused by allergy, then there's no role of antibiotics. And I think this is important because we sometimes get patients who go to the chemist and buy antibiotics over the counter in the belief that these antibiotics are going to sort out all forms of sinusitis. So the point I want to drive home is that not all forms of sinusitis require antibiotics. And the mainstay of treatment would be use of intranasal medications, and they are absolutely safe and they don't get absorbed into the general system, and therefore their side effects are minimal.